Functional mandibular movements include all natural or characteristic movements occurring during mastication, swallowing, speech, and yawning, while the parafunctional movements, these are movements that occur in the clenching or bruxism, which is meaning the grinding of the teeth. Registration of condylar movements. What is it and why do we record it? It is a recording of the paths, positions of the condyles during border movements that are recorded in order to program the articulator to simulate the patient's condylar movements. How is it recorded? It is recorded using the pantographic tracing to program a fully adjustable articulator type, while a semi-adjustable articulator type using the interocclusal records, face-bow records, eccentric relation records, protrusive record, and lateral record. Articulators. Articulators are mechanical systems used to replicate mandibular movements. Types of articulators. Class 1. A simple holding instrument capable of accepting a single static registration. Vertical motion is possible, which is mean non-adjustable. Class 2. An instrument that permits horizontal as well as vertical motion but doesn't orient the motion to the temporomandibular joints. Class 3. An instrument that simulates condylar paths by using averages or mechanical equivalents for all or part of the motion, allow for orientation of the casts relative to the joints, and may be acron or non-acron instruments, which is mean semi-adjustable. Class 4. An instrument that will accept three-dimensional registrations, allow for orientation of the casts relative to the joints, and simulation of the mandibular movements, fully adjustable. Of these articulators types with different classes. Face-bow transfer. A face-bow is a caliper-like device used to record the patient's maxillae hinge axis relationship and to transfer this relation to the articulator during mounting of the maxillary cast. If the face-bow transfer procedure properly done, the arc of closure on the articulator should duplicate that exhibited by the patient. A face-bow transfer should be used when, number 1, cusped posterior teeth are selected. Number 2, balanced occlusion in eccentric positions is desired. Number 3, interocclusal check records are used for verification of jaw relationships. And finally, if the occlusal vertical dimension is subject to change. Two types of face-bow, the kinematic and the arbitrary. The kinematic face-bow generally not used for complete denture fabrication. The because the resiliency of the soft tissues make precise location of the rotational centers almost impossible. Several varieties of arbitrary face bows are available. All are based on an average location of the hinge axis. One average measurement places the rotational point 13 mm anterior to the distal edge of the tragus of the ear, along a line from the superior inferior center of the tragus to the outer canthus of the eye. Last but not least, during the treatment of completely edentulous patients with complete dentures, recording the mandibular movements affected by TMJ, muscular involvements, neuromuscular regulation of the mandibular motion, and ligaments.